Hey, welcome to the Eight Figure Entrepreneur. This is a podcast where we highlight the businesses, the systems, and the mindsets that drive the entrepreneurs towards achieving those 7 to 8 figures and beyond in revenues. Joining me today is a close friend, Dr. Karan Shah. Karan, why don't you get us started with talking about your company and just giving us a brief overview of the highlights so far?
Yeah, sure. Shalin, thanks for having me. I really appreciate it. I've been looking forward to this all week. Here at PC3, or Physician Care Coordination Consultants, what we essentially do is, the simple two-word thing that we do is denials prevention, truly. And if you think about the American healthcare system, which has been in the news of late, we all know it's flawed or there are issues with it. And one of the issues is the denials that we see. It's not the fault of the payer, it's not the fault of the hospital, but there are inconsistencies that exist in that system that lead to denials. And that's where sort of PC3 comes in, helps ensure that the denials don't happen by making sure that the claim goes through from start to finish. So we're sort of the bridge between hospitals and insurance companies.
Okay, that's great to understand what the company does. Are you able to provide any sort of figures that you might want to share publicly of the growth of the company, of how many denials you've worked on?
Sure. Yeah. So we have, the way the company works is we have a physician advising services. We have case management that help. Then we have the denials team that works on the back end. And then we also, one of the things we realize is that the documentation in the chart is of utmost importance. So we have a clinical documentation integrity division that helps with the documentation piece. So summing all that up, so we started in 2022, and we were a total of five of us that started it, and since then we've gone from 5 to 24 employees. From 23 to 24, we've seen a growth of 330% in terms of revenue, and we've sort of gone from 2 hospitals that we started with up to 32 hospitals in 5 states.
That's impressive growth in just a little over 24 months. Because you didn't start at the start of 2022, right? You started somewhere in between. So,
Yeah, absolutely. So yeah, we were sort of looking at 18-month time frame.
wow. What was the what was the founding motivation of this? Talk us through your journey so far as an individual, and then what you brought to the table as an entrepreneur.
Sure. So, it wasn't that, hey, this was just born one day, right? I mean, this is a space that I lived in. So even going back to when I first finished residency, I got this opportunity to look at case management, denials, physician advising when I was at Vanderbilt. And I sort of got to learn there. And I was like, man, this is crazy. Like the money flows through here, and the documentation is important. This is how the hospitals get paid, but there's very little attention and nobody's sort of paying attention to that. So I got more involved in it, went back to business school, sort of said, hey, how can we look at this further? So my most recent prior job before PC3, I was at Baptist as the VP, and I helped set up the entire utilization management physician advising program for Baptist across the state. And then from there, I started thinking, I was like, hey, if Baptist needs help, I got a call from the first client, which was Ochsner down in Louisiana, and they needed help. And I was like, man, if Ochsner needs help, that means the entire nation needs help. And
Hmm,
that's when PC3 was essentially born.
wonderful. So you mentioned about the one particular gap that you're trying to solve within the healthcare system. Now, outside of your company, outside of your current scope, can you talk briefly about what are the other gaps in the healthcare system that somebody should fix?
Yeah. Let's be honest. I mean, it's once again, I don't think you can blame the system in any way. So I want to be very clear on that because it is a complicated system, right? And but I do think, right? I think even instead of pointing faults, it's almost the question is, hey, somebody's providing care, somebody's getting care, and somebody's delivering the care, right? So I mean, just that system itself is complicated. And if you think about that, there are going to be sort of issues in the system that doesn't always communicate with one another. And I think that's the issue, right? I mean, an example, and when I teach medical students about this, I sort of give them this example, right? Think of it this way: if you went to a grocery store where all prices were covered, and you didn't have to pay anything at checkout, and somebody sent you a bill 2 months later,
Mm.
and the option that you have is you pick something that's cheap or something that's more expensive. Once again, remember the prices are covered. You don't know, but you just know that one is better than the other. What are you going to pick, right? And that's the kind of, you're right. I mean, this is the system that we live in.
Yeah, so I get that there's multiple touch points across the entire system, and it's not one particular functions group or one particular function's fault. And there's no pointification going around here, but you do see massive holes that need to be plugged across the entire system. What would some of those be for an upcoming entrepreneur who's maybe watching this podcast?
Yeah, let's say quality, right? I mean, that's always the big question, right? How do you define quality? Do you define quality from a patient's perspective? Do you define quality from hospital's perspective? Do you define quality from the payer perspective?
Mm,
So that's always right, because each person or each entity might have a different definition of quality. So that's always an opportunity when somebody's thinking of something in healthcare, or where's there a gap, right? I mean,
yeah,
another example is always, any kind of operations, right? I mean, healthcare is a big complex system. So there's hospital operations, there is, outpatient operations when you think about it, right? I mean, last time you went to your doctor, you probably waited, not the doctor's fault.
right.
But the reality is, I mean, that doctor probably didn't, and I'm saying he or she, right? Probably didn't
Hmm.
even take a break for lunch that day because somebody showed up late, somebody, canceled their appointment. So there are so many things that if you really, I mean, and that's why, right, healthcare is the largest
Hmm.
sort of employer, right? I mean, if you think about it, most people are working in healthcare, and by GDP, it's over close to 20% of GDP.
I see your point in it. We got to look at it from different perspectives, from the institutional perspective, from the physician perspective, from the patient perspective, and then try and look at the entire system that way. Good insight. Um, Now, across the solutions that you offer, so first, let's be clear, like you do offer more solutions than one, right?
Absolutely.
How do you see that specifically for your industry, so or rather generally for your industry and more specifically for your company, do you see that clients tend to gravitate towards one or two of those solutions?
The way we've created solutions, right? So the fourth thing that I've not even talked about is analytics, right? Data and analytics. So we provide that platform as well. In reality, we've been strategic in we've heard our client, right? We've said, hey, what is it that you want or what do you need? And we'll
Yeah.
provide solutions based on that. So I think that's what we've been strategic about. That's where, it's sort of on a spectrum, right? It's not just, hey, this. Now, when we first start, a client might choose one of the services and then quickly realize that, hey, they need help with the documentation, they need help with denials, and sort of we end up getting the whole, they need help with data and analytics, right? So we end up getting more than just one piece of this.
Okay. So the way that I heard that was that you go into the market trying to figure out what the pain point is, try and get that anchor offering, and then build around that to supplement the
Absolutely.
business.
Yeah, we started as a physician advising company, right? I mean, that was our core sort
Mm,
of tenet that we started with. And then we realized that, hey, this is one, siloed thing, but then you need help with denials on the back end. You need help with documentation on the front end. You need data and analytics to show does this work or not. So we've sort of built around that, trying to sort of be this one company that helps hospitals across the spectrum. And the other unique piece about PC3 is, we don't say, hey, this is our offering, take it or leave it. We'll almost meet the client where they are and say, hey, how can we truly be a good partner
mm.
in this, and not an outside vendor just here for a short term.
You're trying to position yourself as like a market leader. Is that fair to say?
I'd like. I mean, there are other competitors in the market for sure, but yes, I mean, absolutely. From differentiators are some of the things that I've talked about.
Okay. Do, do you foresee that within your competition, when somebody tries to offer the breadth of services, do you see that they might lose focus on that one core offering?
It could very well happen, but the thing is that in healthcare revenue cycle is such a big sort of thing, right? So even within one, there's so many different things that each company can do. So that's where, right, it's like, hey, what is your core, right? I mean, some companies that might be competitors focus on clinical documentation as their core, and then sort of do some other things. Versus our core is physician advising. We have physicians here, we have nurses here, and we sort of we ensure that that's what we're bringing to the client.
Meeting the client where they are, you have achieved impressive growth. Tell me some of the systems that you have put in place to allow you to propel so fast.
Trust me. I mean, that's an everyday, and I'd be lying if I said, hey, it's not a struggle, right? It is for sure. But I mean, that goes back to what makes PC3 great, right? And it's not the system. It's not what we're bringing to the market. It truly is the employees that we have. And that's what makes us great, right? I mean, we have folks that are, they have tons and tons of experience on the hospital side, operations. They have seen the pain points, and they are solvers that want to solve issues and not remain in status quo.
You talked about the systems that you've set up. You talked about that the people that you work with, the people that you've hired are really the driving engine behind your company. Have you given them a mantra to stick by, like a vision statement, mission statement? What does that look like for somebody joining your company?
Yeah, I mean, the biggest thing is that they know that the company, like that it's the company doesn't have employees, right? The employees build the company, and that's what we've always stuck by, and that's what I say, right? That hey, happy employees make a great company, and I feel like sometimes folks forget that it's
Yeah.
truly the frontline folks that make right. I mean, every interaction, if you think about it, every interaction with the client, right? I mean, if you're happy at what you're doing, you're going to have a positive interaction, right? But if you're not, all of a sudden, that's going to be a bad interaction.
What phase do you think PC3 is in right now? So it's, from what I gather, it's in the growth phase right now, and you're looking to expand more. Would that be true to say?
Yeah, absolutely. I mean, we're just, to be really honest, we're just getting started, right? I mean, some of the divisions we started in the last, 2 out of 4 divisions we started in the last 6 months. So
Wow.
we're truly just getting started.
What do the next 3 years look like?
I mean, I'd like us to be a $1 billion company, that's sitting in Louisville.
That would be amazing.
That would be amazing for
Yeah.
sure.
Something that the viewers may not have known is that we're both based in Louisville, Kentucky.
Correct. So yeah, and truly, right? I mean, but at the same time, I want to make sure it's great to hit those numbers, but we're known for, hey, we do right by our clients, we do right by our employees, and that we never sacrifice on quality. Like one of our prime tenets is integrity, right? And that's something that each one of us every day that works here sort of lives by.
So, Karan, I've been reading the news, and you appear there quite a lot. Your company features quite a lot. Tell us more about that. Like, what are the things that your company is known for in the news, and how does it propel your growth?
Yeah, I mean, let's be honest, right? I mean, having good publicity is always a good thing, right? I mean, I will always take that anytime. But yeah, no, we've definitely been very fortunate, right? Once again, for the great work that we're doing, we've been awarded the KY Inno Award for Company on the Rise most recently. Also, I got 40 under 40, which was awesome. I'm still trying to figure out who nominated me for that. So that's great. And then most recently, we were featured on Wave 3 News, where there was a segment and we were a follow-up segment to the denials,
Hmm.
and we were sort of featured to say, hey, how is PC3 helping um,
Yeah,
denials?
I think that's just a testament to the amazing work that you and your company are doing. I want to go back to something that you said earlier, which I think a lot of the viewers will find interesting. You're a physician. You went back to business school to learn business. Tell us how, and then now you're running your own company. Tell us firstly, how do you differentiate between being a physician and being a business person in your current role? And then second, also, what are the teachings from both that have applied you to merge into this current role?
Yeah, that's a great question. The way I kind of think about it is, I kind of I went to medical school because I wanted to escape business, right? I grew up learning about business all my life, right? And I was like, okay, what can I do that's furthest away from business? And I was like, okay, I'm going to go to medical school.
Yeah.
And then during medical school, I kind of fell in love with the business of medicine, right? In the sense that, hey, there are issues. How do we fix it, right? And what I felt, at least at that point, was that, hey, as a physician, I know what's going on in the front lines. I should be able to communicate it back to folks that are making decisions that don't have
Hmm.
background.
Yeah.
And that was sort of the motivation to go back to business school. because I wanted to be able to be the, bridge the gap between the two. In terms of that I think has served me well as I sit on this role, because even today, right? I mean, I'm sort of bridging those two worlds, right? The business of medicine and being a physician. And one thing I'll point out is also that I think what medical school did for me, or what residency did for me, is that ethical focus, right? That, hey, that you always put patient in the center, and
Mm-hmm.
you design
Mm-hmm.
systems around it, you make business decisions around it, and you will never go wrong.
Wonderful. I love the patient-centric focus that you've taken. I'm sure all of this growth came at some cost. Maybe that's the cost of personal sacrifices. Maybe that's the cost of going outside of your comfort zone and learning new things and taking on more cognitive load. Tell me, how have you changed across the past 18 months, or at least the past 3 years, as an entrepreneur, but more importantly, as a person?
I'm smiling because you should ask my wife that question, right? I mean, she can probably answer that better than I can. But no, I mean, you know, you're right, right? I mean, this is sort of day in, day out. I wake up thinking about this, right? Because at the end of the day, let's be honest, I'm responsible for 24 families, and that weighs on my conscience more than truly, whether is this going to work or not. And I think that has sort of made me realize that, I never want to do anything that sort of, going back to the idea that, hey, put patient in the center, design systems that are correct, and that have happy employees that also benefit from this journey.
Okay. Well, thank you for the lovely time that you spent with us.
Thank you for having me.